Good evening and many thanks for joining us live on QTV. You are watching QTV News and I am Ajibintu Drame. In tonight's top stories. On the eve of a threatened strike, the Ministry of Health convened a press conference on Tuesday to update the public about efforts to address nurses' concerns. The Gambia government has announced the procurement of 80 ambulances for distribution to all constituencies across the country in the coming weeks. The Ministry of Health, through its expanded immunization program on Tuesday, updated the press on the current vaccination drive in the fight against COVID-19. At a virtual summit on Tuesday, First Lady Fatou Barbaro hailed the partnership between her foundation and the Mark Foundation, which aims to transform the country's health sector with more trained specialists. Those were our main headlines. Now the news in detail. Now, on the eve of a threatened strike, the Ministry of Health convened a press conference to update the public about efforts to address nurses' concerns. The Health Minister also highlighted government measures to address the healthcare needs of people across the country. Mahmoud Lamin Choi reports.
We are amidst a pandemic with a health crisis facing the world, a time when services of health workers are needed the most. The Nurses and Midwives Association are threatening a sit-down strike, demanding an allowance increment from the Health Ministry. The Minister of Health, Dr. Ahmad Lamin Samate, gives an update on government's efforts to resolve health workers' concerns.
The Executive Committee rallied nurses and threatened a strike sometime in June 2021. Government contacted them and discussions were held, headed by the Secretary General and head of the Civil Service. Allowance suggestions were made and an agreement was made to pay the allowances at the end of August 2021. Work had since begun between the Secretary General's Office, Ministry of Health, Personnel Management Office, and Ministry of Finance to be able to pay at the end of August 2021.
To complete processes for payments of an allowance increment, the parties involved had agreed a proposal which was sent to Cabinet for final approval on August 26th. This, plus the fact it was late and difficult to put the approval in the payroll for August, meant, according to the minister, that it could only be done by the 5th of any particular month.
This was communicated to the Executive Committee of the Nurses and Midwives Association, who were reassured that payment will now be made at the end of September, and it will be backdated to August 2021. Unfortunately, before this communication, there were already threats of a strike by some nurses, and even after hearing this information, the threats of strike continued.
At this press briefing, the Health Minister reveals that government fulfilled its promise for an allowance increment for nurses on Tuesday, 31st of August 2021, and that efforts for an equivalent allowance for other health workers is in progress.
I wish to inform the general body of the nurses that their allowance increments have been paid by the central bank today, and they should check their various accounts. For those working in the 7 subvented hospitals, theirs are being sent to the hospitals for payment.
The minister's statement also captured developments registered in the health sector during President Adama Barrow's led government. This includes expansion, renovation and construction works of health posts and health centers across the country, supply of medical items, and capacity building of health workers.
Point 9, numerous health facilities are being renovated and expanded. Under that, Kuntia Health Center will have overall renovation and expansion starting next week. Brikama Ba and Serekunda Health Centers are undergoing expansion works. Brikama Ba, Basse, Brikama Health Center, and Buyam General Hospital, with the support from the World Bank, all have been assessed and work will soon start.
Building a health sector demands collective commitment from government and health workers for the promotion of an effective health service and the protection of people's lives. The Minister of Health sends his gratitude to and urges health workers to work towards the development of the health sector. Mohamed Lamin Chai, QTV News.
The Gambia government has announced the procurement of 80 ambulances for distribution to all constituencies across the country in the coming weeks. Government calls the plan a community ambulance service initiative geared towards improving timely access to medical emergency services, particularly in remote areas. Mamadou Lamin Choi again.
Building a proper healthcare system for taxpayers means facilitating easy access and affordable health service delivery across the country. As part of efforts to attain that goal, the government has procured 80 new ambulances aiming at improving emergency response for healthcare needs of Gambians, especially in rural areas, through a community ambulance service initiative. The Minister of Health explains the motivation behind the development, citing horrible scenes of suffering facing rural communities during emergency.
The last time we were in Kerardo, the community birth companion was taking a pregnant woman to a health facility at night. They were on a donkey cart from the Kerardo to where the woman could deliver. Unfortunately, along the way, wolves started to attack them. And they couldn't go, they had to go back to the village, and then the woman delivered at home. The other one was at Nauleru. We were there, a similar thing. This time the pregnant woman was on a horse cart. Out of fear, the horse started to run at top speed with the pregnant woman on a horse cart. You can only imagine that. This is sad. So we said, the president said, that something needs to be done about this. And now we are going to have community ambulances stationed in those communities.
As part of plan for smooth operations of ambulances for communities, the Health Ministry has announced that it is putting up 11 ambulance centers at strategic highways across the country to be manned by paramedics for rapid response to accidents, of which there are many. For capacity building, 16 health workers have been sent to Turkey to train as trainers for pre-hospital emergency care of patients.
And now we are going to have community ambulances stationed in those communities so that when we have a pregnant woman who needs to deliver, they call that number, the ambulance goes to the house, picks her up to her health facility. I think that will be a game changer in the health system for the people of this country. So that is the essence.
The plan is set to operate from the early in September. The minister has more on the timely arrival of the ambulances.
In fact, we are expecting the first batch of 20 in the next 10 days, inshallah. And another batch by the end of the month, September. And the first week of October, we are receiving. So by first week of October, inshallah, we'll be getting 55 in country. That's the schedule of delivery. Yeah.
The procurement of the 80 ambulances comes a year after the ministry received 10 ambulances purchased from government's local fund and support from the World Bank. The public will be anxiously waiting for the new ambulances that will bring them closer to a solution to a critical healthcare need, a rapid response to emergencies at community level. Mohamed Lamin Choi, QTV News.
Still on health, the Ministry of Health, through its expanded immunization program on Tuesday, updated the press on the current vaccination drive in the fight against COVID-19. Abibatu Sisi tells us more.
Earlier this year, the Ministry of Health conducted a mass vaccination campaign hoping to vaccinate 60% of the population. According to the Ministry of Health, about 10% of the Gambia's population has been vaccinated since the start of the vaccine rollout in March. The senior vaccine officer at the Ministry of Health, Mamanding Kinte, explains the number of vaccine doses administered in the Gambia.
We've seen 3 different vaccines. For J&J, that's Johnson & Johnson, which has been donated by the U.S. government through the COVAX to the Gambia. We vaccinated 139,367. And for the Sinopharm that we received from our brothers from Senegal, we've vaccinated 5,682. And for the AstraZeneca that we began with, we've vaccinated 48,483.
The ministry further highlighted that the vaccination has been conducted in all 7 health regions of the country and that more women have been vaccinated than men.
We've seen CRR vaccinated about 10% of its population. And we know we're targeting a population of 18 and above. And LRR vaccinated 17.8% of its target population. And this is 18 and above. All those 18 and above. And North Bank East region vaccinated 11% of its population. And North Bank West region vaccinated 16.0%. URR vaccinated 10.9%. Western 1, being the driver due to population, vaccinated 9.5% of the population, and Western 2 vaccinated 7.6% of the population.
The Ministry of Health says it recognizes that there has been significant improvement with regards to vaccine hesitancy. The Q Group also launched a massive vaccination campaign for its staff, their families and the public, encouraging them to get vaccinated. This effort has been welcomed by stakeholders.
Goodwills from partners to support communication. QTV, we've seen the 26th. This was shown live on QTV as a form of advocacy so that people will know vaccination have started and where they can go for their vaccines.
The Ministry of Health wishes to assure the public that the COVID-19 vaccines are safe and urge those yet to be vaccinated to go and do so to protect themselves and their families. The Ministry of Health has targeted vaccinating at least 1.4 million people and is encouraging people, especially those with underlying conditions that put them at greater risk, to get vaccinated. The public is reminded that effective vaccination is necessary to end this pandemic. Meanwhile, people should be vigilant and continue observing social distancing, wearing face masks, hand washing with soap and clean water, and using hand sanitizers. For QTV News, I am Abibatu Sise.
From that story, we will go for a short commercial break. Still to come, we have more stories. Do stay tuned.
Check out the all-new Tigo 8 at S-Pass Motors. Call 3522-222 or 353-2222 for more information.
Share the best product in town is back. QCell's MiFi router. Get the best MiFi in the country for just $2,800 and connect up to 15 users with 4G internet speeds and a long-lasting battery life. So rush now to any of our customer care locations and get the best for less while stocks last. For more info, call our customer care on 111. QCell, Senior Boss, the Gambia's quality network. We innovate, others follow.
Welcome back from that commercial break. Now, at the virtual summit on Tuesday, First Lady Fatou Barrow held the partnership between her foundation and the Mark Foundation, which aims to transform the country's health sector with more trained specialists to respond to the health needs of the people. Aliou Sise reports.
The Mark Foundation is a non-profit organization that aims to improve the health and well-being of the people. The summit was co-chaired by First Lady Fatou Barrow of the Gambia, who is also an ambassador of Mark Foundation More Than a Mother initiative, and Senator Dr. Rasa Khalej, CEO of Mark Foundation, who is also the president of Mark Foundation More Than a Mother. 45 young Gambian doctors have benefited from high-level overseas training scholarships in many critical and underserved specialties, including infertility, courtesy of the Mark Foundation in partnership with the First Lady of the Gambia. Rasa Khalej, CEO of Mark Foundation, recognizes the First Lady for what she says is the First Lady's commitment to forge international partnerships like with Mark Foundation to transform the patient care in the Gambia by improving access to quality and equitable healthcare solutions.
It is also another sign of your dedication and commitment to the people of the Gambia and to the benefit of the people of the Gambia. And this also ensure that your great role as a very important ambassador.
First Lady Fatimata Barrow has been the first ambassador of Mark Foundation More Than a Mother since 2017 and believes the advent of the COVID-19 pandemic has justified more than ever the need to have more trained health specialists. While uploading the alumni, Madam Fatimata Barrow said she is proud of them as she encourages them to keep serving the people. While she reveals ongoing plans to construct a cancer center, Madam Barrow equally seeks the partnership of Mark Foundation to support the construction of an infertility center in the country.
And responsibilities are to support and empower them so that they can perform their noble mission and provide the quality and equitable care to our population nationwide.
The virtual summit also discussed future plans for girls' education in the Gambia to increase enrollment and retention. Claudia Cole is the Gambia's Minister for Basic and Secondary Education.
I want to thank you for the invitation and to look forward to working with the Mark Foundation in support of girls' education in the Gambia.
Beneficiaries use the summit to share the impact of the scholarships on their careers.
My name is Mam Nabuli. I must say I am very grateful for having been given the opportunity to study a postgraduate diploma in sexual and reproductive medicine at the University of South Wales.
My name is Masren Linjai. I want to take this opportunity to thank the Mark Foundation CEO, Dr. Rasha College, the First Lady of the Republic of the Gambia, Madam Fatimata Barrow, and the foundation for giving us this opportunity to go and attend assisted reproductive technology in India.
The Mark Foundation intends to continue working with the First Lady's Foundation to provide more needed and more deserving specialties. This is expected to provide an army of well-trained, skilled, and specialized doctors to transform the healthcare landscape in the Gambia, therefore addressing the many cases referred for overseas treatment. The summit also brainstormed on how to address other health and social issues such as breaking the infertility stigma, stopping gender-based violence, and the ongoing COVID-19. Reporting for QTV News, I am Aliu Sise.
Moving on, the Gambia Teachers Union Cooperative Credit Union on Tuesday commemorated its 25th anniversary, having been formed in 1996. The event was held at the union's Cooperative Credit Union headquarters in Kanifing. Yahya Jawa picks up the rest of that story.
The establishment of a credit union within the Gambia Teachers Union by the National Executive Committee of Gambia Teachers Union came in the wake of a special resolution passed at a Teachers' Congress in 1992. The resolution mandated the leaders to initiate a scheme that would enable members of the GTU to access affordable microfinance services. The aim was to create a conducive environment for teachers and educationists who for long had struggled to carry out financial transactions, as many were being subjected to several forms of financial disadvantage attributed to the unfavorable policies of financial institutions such as the banks. Babukar Juf, the general manager of the GTU-CCU, reflected on the struggles and the journey he and the other founding fathers of the credit union went through to give union members access to easy and affordable financial services throughout the country.
Today, Gambia Teachers Union Cooperative Credit Union is a global brand. Not because we are the richest credit union, not because we are the most organized, not because we are the most serious, but because of our resilience and our determination to impact the lives of our members. And that we do with sincerity, we do with honesty, and that's why again today, it's important that we look back and give thanks to the Creator, but we also look inside, we look inwardly, and thank those who are responsible.
As I saw, the Deputy General Secretary of the Gambia Teachers Union says celebrating 25 years of existence of their cooperative credit union is symbolic and worth commemorating, and highlights the significant achievements of the union.
Recognizing our achievement is quite encouraging and thought-provoking. Therefore, it is imperative to know that our collective achievement as cooperators has proven our high value not only in the Gambia, but the sub-region in general, both in terms of economic growth and the improvement of the lives and livelihoods of our esteemed members.
Deputizing the Permanent Secretary of the Ministry of Basic and Secondary Education, Usman Ba, the Regional Education Director for Region 1, shared his thoughts.
Today we are grateful and thankful to Allah to having guided this credit union up to this date. 25 years ago it started. It started as a small one, but has grown to one of the best credit unions in the sub-region, not only in the Gambia, but in the sub-region, I can say.
Founded through trying conditions, the Gambia Teachers Union Cooperative Credit Union is one of the leading credit unions in the Gambia that operates and delivers excellent services to teachers across all regions of the country. Reporting for QTV News, I am Yahya Jao.
Speed bumps have been constructed along the Basse Highway to slow down speeding motorists, motorcyclists and other road users to prevent accidents. This report by Fode Mane is narrated by Babukar C.
Wherever people and cars are in close proximity, traffic safety is of heightened concern because aggressive driving is a safety risk for pedestrians. Speed reduction is one way to protect people. Slower traffic speeds reduce both the likelihood of an accident and the chance of a fatality should one occur. Residents and pedestrians are delighted about the installation of speed bumps on the highway by the National Road Authority. Musa Jao, a resident of Basse Kobakunda, said the initiative is a welcoming one and has a word of advice to the drivers.
They have to drive slowly because even on the Kodula route there is a speed limit. When you enter a village or a town, there is a speed limit that you should run. So, but some of the drivers, they did not get a proper Kodula route or they are not well trained. You know, even the signboards sometimes they don't know. Even the first day this sleeping police was met here, you know, one driver came here, he came with a full speed with a rider, but he fell down, he was taken to the hospital. That is his fault.
Sajo Krubali, a teacher, explains the importance of these speed bumps, also known as sleeping police, especially with a school nearby.
Since 2006 up to 2008, up to 13-14, it was a terrible thing so far within this highway because by then every time there are a series of accidents, and then sometimes even during break or when it's time for go home.
Alajiba, a pedestrian, gave us his views on this new development.
This will reduce the rates of accidents in the town. It is great help for the community of Basse. We are very happy to have this sleeping police along this highway.
One of the great strengths of speed bumps is that they remain a deterrent no matter how accustomed drivers become to their presence. Drivers can disregard a road sign, but not a speed bump. Cheno Sleman Jallo, a former traffic police officer, now a taxi driver, said speed bumps not only slow down traffic, but also helps to promote safe driving.
Sleeping police is very important because it will limit the speed to zero to anybody who is coming, and it will be reduce also accidents, you know, because here you have animals crossing, people crossing, and the road is so congested. So this has definitely helped the traffic as far as traffic is concerned.
Mr. Jallo urges the police to sensitize the public about the newly installed speed bumps.
Urge the officers also who are in traffic so have this a forum in a radio system, you know, so that everybody is sensitized. When a new thing comes into the area, you have to sensitize other people because other people, they don't know about the sleeping police. That's the most dangerous part of it. You know, when you don't know sleeping police is in front and then you come with a high speed, it's very dangerous.
Last week, the lead surgeon at the Edward Francis Small Teaching Hospital, Dr. Keba Marena, revealed to QTV that at least 14 people die every month due to a road traffic accident in the Gambia. According to a report published by the Point newspaper in November 2020, the Gambia Police Force stated that out of 775 road accidents recorded, 115 people lost their lives. In Basse, the development is welcomed and the community is delighted that at least this will help prevent, if not reduce, frequent road traffic accidents. Babu Karsi, QTV News.
Before we end, here's a recap of our main headlines. On the eve of a threatened strike, the Ministry of Health convened a press conference on Tuesday to update the public about efforts to address nurses' concerns. The Gambia government has announced the procurement of 80 ambulances for distribution to all constituencies across the country in the coming weeks. The Ministry of Health, through its extended immunization program on Tuesday, updated the press on the current vaccination drive in the fight against COVID-19. At a virtual summit on Tuesday, First Lady Fatou Barrow hailed the partnership between her foundation and the Merck Foundation, which aims to transform the country's health sector with more trained specialists. Well, that's it from me in tonight's edition of the news. Thank you for watching and have a nice evening.